did that for 10 years, got very bored. And so then I left in my practice in 1986 at GMJP in dental medicine. Dental medicine nobody's ever heard of. I primarily do just jaw orthopedic repositioning therapy. We do a little orthodontics and orthopedics on the side. Next slide. So pain is very poorly understood in our medical system. And we're missing entirely a sensory theory of illness, which is because of their lack of understanding of pain and how pain manifests and where it comes from and what's the primary, where it comes from. So pain comes from what we call C fibers. We'll have some pictures of this here in a minute. And anytime there's a sensory stimulus to a C fiber, it goes out and pumps these little vesicles and they dump out the substance P in the body. And we'll go and show you a little bit those pictures. We have a look at the sensory homunculus on the sides of the brain. There's regions of the brain that measures pain, our sensory part of the brain. And we'll show you how that's broken down. And then the trigeminal is integrally tied in with a sensory theory of illness, because the trigeminal composes 28% of your sensory cortex, over a quarter, and almost a third of it. And between it and upper cervical, it's 50% of your sensory cortex. So the body runs on sensory information, and when there's a defect within the trigeminal system, and there's insult, then it causes massive substance P level disturbances and consequently major illnesses across the board. So these are different things that can cause trigeminal disturbances, jaw orthopedic defects. So everybody knows about orthodontics, but nobody knows about jaw orthopedics. 15 years ago, the American Dental Association changed the official title of orthodontist from orthodontic specialist to orthodontic and craniofacial orthopedic specialist without changing their educational requirements. Right? So they name grabbed, they know there's something there, but they still, at none of the orthopedic programs do they teach jaw orthopedics, including all of our local fine dental schools. And when your substance P is a major sensory modulator in the body. And so when your substance P levels go up from stimulating, in most cases, trigeminal disturbances, then it causes a generalized hypersensitivity syndrome, and that makes pain more easily triggered all over your body. And then there's a broad cascade of events that happens with that. It's also a major neural secretory modulator. It throws off hormones. So what substance P does to the body is it alters cell membrane permeability. So cells are like a little battery, and when you make them porous, they lose their voltage potential and then they fire too easily. Right? And so anything you can put in there to stabilize cell membranes, like cannabis oils, right? Anything that stabilizes Tegretol or Neurontin, all the seizure medications stabilize cell membranes. So we're going to present a lot of research here today about insights that I've gained that the medical community just hasn't clued in on. For example, substance P in the research litter is the known cause of most seizures, right? And it destabilizes cell membranes, people go into seizures. But nobody has the sensory theory, so they don't know how to go back. The medical community doesn't know how to go back and get rid of the substance P. They don't appreciate that substance P primarily comes from a defect in the trigeminal zone. Next slide. So this is your sensory homunculus, right? This is the little side of your brain, and this is how it's proportioned to the body. That's because this part of your body has 100 times more dense C fibers, pain fibers. That's why it's so painful to get your teeth worked on. It's painful to get something in your eye poked in your eye. It's so painful to get an ear infection. This part of your body, when it hurts, it really hurts. You all know that, right? That's what TN's all about. It's because the density here, when it gets triggered, it really triggers it. But this defect in this zone then disproportionately influences sensory throughout the whole body. And sensory, take the next slide, please. Sensory is what the body runs on. So this is from Wikipedia. People look at substance P in Wikipedia. Okay. It's a neuropeptide. The difference is that it does not have a reuptake mechanism, not a neurotransmitter. Okay. It's released from terminals of C fibers. It's found in the brain spinal cord associated with inflammatory processes and pain. Okay. So your ulcer, right? You get inflammatory reactions. The endogenous receptor for substance B is neurokinin 1, so it's on the outside of most cells. And so when substance P attaches to that NK1 receptor, it flips internally and makes the cell membrane porous. And when cell membranes become porous, the guts leak out of the cells, and that causes a redness, edema, and swelling, right? And it makes cells become efficient. That's fatigue, right? Exhaustion. And when cell membrane becomes porous, calcium rushes into the cell and messes with mitochondrial function. Calcium is the primary means by which the mitochondria communicates, and that's the primary cause of most forms of cancer. So all these cells have these receptors on them. Substance P amplifies or excites most cellular processes. So all my TMJ patients have a generalized hypersensitivity syndrome. They're sensitive to noise and the light and hot and the cold and the food and the drugs and the stress. Right? When that substance P levels go up, you get sensitive to everything. Substance P is a key first responder to most noxious extreme stimuli. Okay? So that extreme part in the trigeminal, due to the density of pain fibers, a little poke is a big poke in the trigeminal. When there's something a little off, it's like getting a high filling. Just they leave that thing just a few thousandths of an inch too high and it drives you nuts. This is an extremely hypersensitive area. And it's also, it's that neuroplasticity effect too, right? As what happens in most cases is that people these days are born with a bad bite, and then it's some kind of trauma that overlaid on that bad bite, and from the bad bite they can't recover. So there's a constant microtrauma stress going on within this system because the bite's off from birth. And when you take medical history, you can see that bite being off from birth because they had a high incidence of ear infections when younger. They had a migraine history. They had a lot of skin disorders, eczema, seborrhea, psoriasis. They had, but the bite dysfunction causes a continuum of disorders throughout your lifetime. And as you get older, it gets into different things.
Dr. Jennings. Oh, can you talk about like how jaws have pretty much been shrinking over time?
Yeah, I got some slides.
Oh, yeah, some slides.
Yeah. Molecule which is rapidly inactivated or at times further activated by peptidases is rapidly released repetitively and chronically as warranted in the presence of a stressor. That being covert bite dysfunction for the vast majority of our population. Unique among biological processes, substance P release and expression through autocrine, paracrine. So it's like an endocrine system. May not naturally subside in disease is marked by chronic inflammation, including cancer. And physicians never talk about substance P because they don't have a pharmaceutical remedy for it. And they just never go there. And most of them know very, very little about it because it's not in their pharmacological book. discovered in 1931, it's 11 amino acid neurotransmitter, extensive research since 1980, no reuptake mechanism, slowly degrades, partly comes from C fibers, developed in the body. It's depleted out of the body with cayenne pepper. Okay? So that's capsaicin creams, which they make you burn. It makes your body excrete the substance P, but it ends up depleting it of the substance P. So people that eat a lot of chili peppers are tough hombres. They don't feel pain as easily. They primarily use hot foods and hot climates to make the people able to tolerate hot weather better. They're not as sensitive. Elevated levels cause generalized hypersensitivity syndrome, causes cell membrane porosity, lower cell membrane polarity, and fires typically. Next slide, please. Secondary effects, inflammation, neurosecretory elevated. It's elevated in all autoimmune disorders. So if you depolarize cells, eventually you'll get allergic even to yourself. Right. Substance P is the known cause of asthma. It is the known cause of allergies, but MDs don't know either of those. Right? The researchers clearly know this, but physicians, they have a lot of different theories as to why it does come down, but researchers clearly understand that process. Skin disorders, substance P is a major regulator of skin integrity. It's the known cause of eczema, psoriasis, acne. It mediates stem cell differentiation, which is wound healing, but that's also anemia, mononucleosis, leukemia, right? Ulcers, right? Controls gut motility. So what normally happens on an individual is when you take food in and you chew and you work this part of your body, your substance P levels bump up a little bit, and that turns on your gut to process the food that you just sent down to it. Right? But in a lot of my patients, they'll have intermittent constipation diarrhea. It's a known modulator of brain inflammation and glial activation. There's quite a few studies now showing anytime you either irritate the masseter muscle or the TMJ joint, it causes immediate inflammation of the brain, which is a precursor to all neurodegenerative disorders.
Like Parkinson's.
Parkinson's, Alzheimer's, dementia, it's elevated in autism, MS. Next slide, please. So on the skin, C fibers, there's other kinds of fibers too. These travel a lot faster. These travel really slow, right? You stimulate these. Next slide, that's a C fiber. Right, you stimulate that C fiber, send the signal up to the brain, right? Goes through your spinal cord. Next slide. But when you stimulate this cell, there's little vesicles associated with this electrical impulse, and this causes substance P release, and on mast cells, it causes histamine release, the inflammatory response. And on blood vessels, it causes blood vessel dilation. That's all your red is the inflammatory response. And in the brain, it speeds up the brain, right? The glutamate will burn out brain cells, and the substance P. In the last 5 years, there's pretty extensive research showing that substance P is in the brain is the primary mediator of depression, anxiety, bipolar, anger, violent, and addictive behaviors. They're not going to get anywhere on the opioid crisis without understanding this. The only thing they have to throw at these people is opiates, and they don't. These people are all self-medicating. The vast majority of them don't feel so bad that they'll take anything in to make them feel better. And opiates is the only way that they've learned to be able to modulate that.
What people are you talking about? People on pain?
Addicted, no. Addicts. Next slide, please. So the brain uses the integration of these sensory signals to maintain homeostasis in the body, whether it's temperature related or pain related. Right? The body runs on sensory input, and consequently, chronic elevated substance P level leads to wide spectrum of medical disorders. Okay? evolving human condition. All primitive humans' bite was end on end. Right? Front teeth tip to tip. Only modern humans have overbites. And that's been the last 10,000 years. Overbite causes excessive range of motion and function in the jaw, muscles, and TMJ joint, exciting the trigeminal nerve. Right? And dentistry doesn't know that. Medicine doesn't know that. Nobody's. Because back to the primary thing is that orthodontists' goal is to give you pretty teeth and not to line up your jaw. They're to give you orthodontics and not orthopedics. There's some very basic, fundamental, critical concepts in jaw orthopedics. And number one is that you should open and close on a smooth arc. People that have overbites, they don't open and close on a smooth arc. As they open, their jaw drifts forward, and then they close through a convoluted pattern. You do like they have computerized jaw tracking equipment that will measure all this on people. And so there's people with chronic pain need to have a neuromuscular workup, right? That's computerized jaw motion analysis and surface electromyography analysis. People who have an overbite, the temporalis pulls the jaw back, and so it fires first and prematurely. So if you're doing surface electromyography, you can see when somebody goes to close that the temporalis is firing prematurely and torquing. What should happen on a good bite is that both muscles fire equally and simultaneously. Right? And so when you put an overbite on somebody, so let's talk about jaw biomechanics a little bit more. Dentistry doesn't know this either. So this is the only joint in the body that can slide. And because it can slide, we think it's okay for it to slide, but it's not okay. This joint functions much better if it only rotates and doesn't have to translate. When you put translation, when function requires that this joint has to translate, it excites this nerve more. If you have an overbite, you have to slide forward to bite things off. You have to slide forward to control airflow when you're talking, and there's a hypermobility in the system. Right? And it's the jaw falling back, in most cases causes sleep apnea and snoring, which now afflicts 60% of people over 60. Right? And so muscles are strongest at their resting length, and so muscles attached to your lower jaw to be strongest whenever they have to service the furthest point from your jaw joint, where they have the least biomechanical advantage, and that's when you're tip to tip. So muscles attached to your lower jaw to be most relaxed and strongest when you're biting tip to tip. So there's just basic biomechanics here that the dental profession has failed to acknowledge, failed to appreciate. Next slide. So the underlying problem in most cases, from my perspective, is it's a constant elevated substance beat from jaw misalignment. Next slide. And the solution is precision jaw orthopedics with the use of twin block Prozac appliances. So you can see there's an upper appliance here and a lower appliance here and a little plastic ramp in between, and this person's biting out tip to tip. To get the lower jaw forward is not a process that's taught in orthodontic schools anywhere. Twin blocks were invented by a Scottish guy 30 years ago, William Clark. And that little ramp between the upper and lower appliances gives you enough sensory information to retrain the jaw forward. On 95% of people, if you go and throw a tongue blade between their front teeth and have them open and close, they automatically close tip to tip. Right? So you just have to make an appliance that will support them where they want to be and won't let the jaw fall back. Right? Braces won't do that. That's all our orthodontists are taught to do, is to do braces. Okay? They're not taught how to manage other processes. And And when you have a TN case, they're now neuroplastically hypersensitized, and you have to do things that are really, really precise, or like your experience, it makes you worse. Right? It has to be done really, really precise. And on not only TN cases, but most of my cases, you can't use carbon paper. Carbon paper is not near accurate enough for the precision that you need on treating these kind of cases. We use a polyvinyl siloxane, which is a silicone paste, squirted in and have a bite, and it's about 30 times more accurate than carbon paper. If I'm getting it even. Next slide. So here's orthodontics versus orthopedics. So orthodontists are very confused. They think getting your teeth straight gets your jaw lined up. Totally different processes. Totally different goals, totally different. They're basing their treatment on structure records to meet a norm, that what they think is normal, right? In jaw orthopedics, we're doing functional records and seeing where that jaw wants to be, not trying to make it conform to a particular dental norm. Like I had one young boy, he's about 24, beautiful teeth, great orthodontics, he was in severe facial pain, severe cognition, shut down, just severe pain. And when we got him, he'd been to Kaiser, and get operated on twice, did some joint lavage and stuff on it twice. But when we got him done, he was an 1/8 of an inch underbite. Right? He came in, he could only open 18 millimeters. Now he can open 54 millimeters, totally out of pain, but he's got an 1/8 of an inch underbite. His lower jaw functionally wanted to be that far forward. Right? So now we gotta go back and orthodontically move those upper teeth forward to stabilize them in that orthopedic position. But we have a clear understanding of the difference between orthopedics and orthodontics that the dental profession does not have. So the problem is you go to the dentist all your life and they never check to see if your jaw is lined up because they don't know how. They've never been taught how to do an orthopedic assessment. They never look for that arc of opening and closing. The other criteria on a good bite is you should bite and talk on the same trajectory. Biting is a skeletal phenomenon and talking is a muscular phenomenon, and you don't want those to be in conflict. You want the skeletal system to be at the same position that your muscular system is. Next slide, please. So, I want to thank you guys for letting me share this with you. The implications of jaw dysfunction is massive. If you go to the dentist, they don't check your bite. Consequently, dentistry ends up throwing away more than half of all the work that it should be doing. And consequently, people suffer very broad spectrum of medical illness because of that reason, right? The bites, we touched on a few of the things here today though, but the research shows that bite therapy, jaw alignment therapy is 85% effective at eliminating headaches regardless of the type of headache. Right? If you see massive ear problems, hearing loss, tinnitus, all kinds of other ear symptoms. Eustachian tube dysfunction, can't clear with altitude, can't clear flying on an airplane, right? All those different kinds of things. You see, so the Japanese came here in 1975 and saw what a group of dentists were doing in the Midwest. And they went back home and they pulled a major researcher out of every university and threw them into a think tank. And they've done 40 years of research on bite destruction in animals. They've taken these animals and they throw the bite off on them, see what happens. And only one of their articles that they've ever published is on our MedSearch or PubMed.com. Right? But basically what they find is every time you shorten the teeth on one side on animals, it makes the opposite side of the body go into tension. So anytime you shorten that teeth on animals, they all develop scoliosis. Right? So scoliosis, in most cases, is going to be a bite problem. Nobody in this country is looking at it. They've been doing this for 40 years. Right? When you peel the bite off on animals, their autonomic system goes totally wacko on them. All their blood chemistry, all the minerals and everything in the blood goes very, very berserko. They get heart palpitations, heart irregularities, and broad spectrum of conditions on animals. In humans, again, a lot of the musculoskeletal problems are related, a lot of the hypersensitivity problems are related, a lot of the immune and autoimmune. When you open up cell membranes, it makes cells vulnerable to viral and spirochete invasion. There's a researcher at Children's Hospital in Philadelphia. He says if you could control substance P, you should be able to control HIV. But for the cell membrane porosity, the viruses can't get into the cells. Right? The sensory theory, from my perspective, is the cause of the common cold and flu. Colds start with a neurological storm and not an infectious symptoms. Right? It's what your mother always told you. You can't go out with wet hair. Can't go out. You have to keep your head wrapped up. If you get too much cold stimulus to the trigeminal, it's going to trigger an electrical storm that causes making it alter your mucus secretions. Right? Start getting water eyes, runny nose, all this stuff. Your autonomics go off. The autonomics travel with the trigeminal, and anytime there's a trigeminal disturbance, it'll alter the autonomics. And sneezing, coughing, vomiting, nausea, those are all controlled by substance P. Right? So colds and flus are an electrical storm that ultimately turns into an infectious condition with the cell membrane porosity. We treat a lot of seizure cases also. I have in excess of 80 seizure cases where the seizures have gone away after we fix their bites. Right? I tried presenting this to the American, the local chapter of Epilepsy Foundation. And they said they were only interested in looking at FDA approved remedies. And I said, well, that's only pharmaceuticals. And they says, maybe so. I said, so you must not be looking for the cause. You're only looking to manage these people. Right? So we do a lot of seizures. We do, what's the other things we do?
Parkinson's.
We do Parkinson's. So there's, in the last 10 years, there's pretty extensive literature on substance P and Parkinson's. Emma Thornton, 2008 PhD thesis, Australia. She showed that she could reverse experimental Parkinson's in rats with substance P antagonist at carpet.